One of the major issues care staff working in care homes and domiciliary care settings face is the challenge of assessing and assisting fallen individuals safely and efficiently. A fear of the potential risks of lifting someone who is injured can often lead care staff to call an ambulance, when actually this may not be necessary. So, the question is, how can we de-risk falls response? This is where HelpFall comes in. But first, what is HelpFall? HelpFall is the digital post-falls decision-making and reporting tool that supports care staff to safely assess a person who has fallen and helps them decide whether to lift or assist them from the floor using safe manual handling techniques and equipment. So, how does HelpFall de-risk falls response? Here are the 3 key reasons. At the heart of HelpFall is a traffic light system. This visual system helps care staff quickly determine the level of risk associated with a fall and guarantees the appropriate response for each patient. Firstly, we have the red category. This indicates a major injury. In such cases, HelpFall advises care staff not to lift the fallen individual and instead call an ambulance promptly. Secondly, we have the amber category. This indicates a minor injury. Although ambulance assistance is not necessary, the fallen individual still requires some medical attention. HelpFall will suggest that care home staff or an urgent community response team can attend to the person, providing the necessary assistance and support before lifting them up from the floor. And lastly, the green category. This indicates that the fallen person is uninjured and can be safely lifted from the floor. HelpFall guides care staff to use specialist lifting equipment, such as the Razor lifting chair. By avoiding unnecessary ambulance call-outs, HelpFall ensures the best possible outcome for the fallen person and helps prioritise the allocation of emergency resources such as ambulances to where they are truly needed. HelpFall includes a reporting feature as part of the assessment process. Each time HelpFall is used to assess a fallen person, an instant report is generated and sent to the care home. This report can be shared with the care home's multidisciplinary team. This allows them to determine appropriate follow-up care for the individual and indeed can help with falls prevention work, as well as improving collaboration between care homes and MDTs. The reporting function of HelpFall gives care home staff confidence they have done the right thing at the right time for the resident and gives them a report that they can refer back to if needed. This is key to reducing the risk and reducing the fear of care staff, enabling them to provide the best care possible for their residents. By guaranteeing the most appropriate response for each patient, HelpFall reduces the risk of the patient experiencing a long lie whilst waiting on the floor for an ambulance. Traditional falls assessment tools are typically risk-averse and very black and white in the guidance that they give, often advising the user to call 999 when any form of injury is present. For example, if a person has fallen and suffered a minor cut to the arm, traditional tools would tell the responder to call 999. In reality, these minor injury falls can usually be treated within the care home or by a UCR team. HelpFall has been built to reflect this and only reverts to calling 999 for major injury falls. But is HelpFall proven? HelpFall has been implemented by multiple NHS integrated care boards across the country and is currently being used by care homes, domiciliary care organisations and rapid response teams, to name just a few. Recently, Suffolk and North East Essex ICB implemented HelpFall in care homes in their area, which has empowered and upskilled care home staff to safely assess and respond to falls. As a result, Suffolk and North East Essex have witnessed significant improvements to the outcomes of falls in care homes, with an 84% reduction in ambulance call-outs to care homes from falls, and the percentage of non-abnormality conveyances from falls dropping from 27% down to 0. So, as these three reasons show, HelpFall enables care staff to safely assess and, where guided, lift persons who have fallen. By giving care staff a clear and simple process to follow, along with reporting that shows the situation at the time, care organisations can successfully de-risk falls response with HelpFall. To find out more about HelpFall and how it works, please go to felgains.com/HelpFall.